every single one of them were by telemedicine, weren't they?
Yes,
Until you came in this courtroom Friday, you never saw this woman in person, did you?
correct.
Were you ever concerned about her mental health as a person?
Absolutely.
She was crying. She told you symptoms that she couldn't get out of bed. Isn't that right?
At one time she said it was difficult to get out of bed
Oh, difficult to get out. Why was it difficult for Lindsay Clancy to get out of bed?
because she was very depressed.
And did you give her a hug? Oh, no, you're on telemedicine, so you couldn't give her a hug, could you? You didn't have any chance to even look at her in person, did you?
I could look at her. It was always a video appointment. I couldn't give her a hug, but that's not actually something that psychiatrists typically do with patients.
I imagine. Now, I'm looking at you, and you've got the witness stand cutting you off in half, right? So I can't see from your waist down, your legs, your feet, your hands, anything. That's the same view that you have on the telemedicine, right?
Yes,
Isn't it fair to say that you've studied and that you've learned that there are objective manifestations that patients may have that would be a tell, like if you're playing poker, you have a tell, that would be an indicia of the fact that they're stressed or emotionally disturbed, right?
yes,
Like hand wringing, right?
yes.
Were you able to see the hands wringing when you were on telemedicine?
I don't recall seeing her hands.
Do you recall, how people sit there and they do this with their leg and the leg bounces because they're going through some type of emotional stress? You couldn't even see her legs, could you?
I couldn't see her legs, but I knew that she was under stress.
So when she came to you, September 15th, I believe, is the first time that you all actually discussed her condition, correct?
Yes,
And looking at the medical records, which the jury will be able to look at, it says visit date, September 15th, 2022, and you can look along with me if you wish. Indicates why she came to see you, right?
yes,
Right? Yes?
yes.
Okay. Why did she come to see you? According, not guessing and speculating, never mind the TV. You just look at your notes. Tell me what brought Lindsay Clancy to your office.
Postpartum anxiety.
Is that it? Is that what you noted in the records?
Well, those were her words when asked, what are the problems for which you are seeking help?
I see. Postpartum anxiety. Now, as a psychiatrist, meeting with this young woman after a month or so of working as a psychiatrist for Astor, there are tests that you administer to a woman who's in postpartum to find out what type of anxiety they have, right?
Well, there are some screening tests, but the most important thing is what the patient tells you and what my assessment is in the session.
I see. And that would carry through the Tufts evaluations for all 14 of those meetings, is what the patient tells you, right?
Yes, and what I observe from the session
Through the television.
through the computer.
What, if you can tell me, is the Edinburgh test?
It is a scale that looks at symptoms of postpartum depression.
And when you administer, that's a major test, isn't it, for a doctor to evaluate a patient for PPD?
I wouldn't say it's a major test.
It's a pretty big one, though, isn't it? It's the only one that measures the postpartum depression, right?
It's a common one.
So what?
Commonly used.
Commonly. All right, so when you used it on Lindsay, when was that administered to her?
I did not use it on Lindsay.
Why?
We used the PHQ-9, which
What
is
is PHQ-9?
it's a depression screening form.
That's like generalized anxiety disorder, general depression. It's got nothing to do with a woman suffering from postpartum depression, does it?
I disagree.
Well, do you agree that people, perhaps that may know a little more than you, determined that the Edinburgh scale is the appropriate scale to administer to a pregnant or postpartum woman?
The state has the form.
You're familiar with the Edinburgh scale, right?
I've heard of it.
And can you explain to me how it's graded?
No, I cannot.
There are 30 questions in it, are there not?
I don't use this scale, so I don't know how many questions there are.
So the Edinburgh scale, do you even know that the cutoff for someone that is depressed in their condition of postpartum would be 15? Anything over that, they're in severe depression?
Okay.
You know that her first Edinburgh test that was administered to her put her at a 23?
Objection. No rule.
Severe depression?
I was not aware of this test. I was not aware that this had been administered to her.
Well, you know that except for the Prozac that she had when she was a nurse, what, 23 years old, she hadn't, other than seeing her own doctor for having a baby, she hadn't seen any doctors. You knew that, right?
know exactly which doctor she sees. I think we ask about your primary care doctor, but she did not report any other medical issues that she was under treatment for.
So is it important for Dr. Jennifer Tufts to know whether or not a patient who is coming to you for help has a prior medical history other than what they might tell you?
Well, when patients are able to advocate for themselves and share their medical history, we rely on what they tell us.
Was she able to advocate for herself, in your opinion, when she came to see you, when you evaluated her in September?
Absolutely.
How about October?
Yes.
How about November?
Yes.
How about December?
Yes.
And your medical records, you would agree, show that during that period of time, that she was deteriorating. It was a word that was used on Friday. Isn't that right?
So
No, so. You used the word deteriorating on Friday, did you not?
she was a little bit worse at certain appointments, and the deteriorating word, which is not my word choice, is what is in the note because I had to select that.
Because why? You have some kind of a program that you have to check the box and you have to bring down the drop box? You can't take a pen and write something down about a patient?
There are certain parts of the note where I can write whatever I feel is necessary, but that specific aspect of the note is a button where you have to click one of three choices.
So when the jury's going through your medical records, one of the things that they're going to see is that when you meet with the patient, you have a form that you fill out where it says, if you feel like you're going to harm yourself or somebody else, make sure you go to the emergency room, right?
Yes.
If you have any urges to harm yourself or others, go to the nearest emergency room. That's in every single time that you meet with a patient, right?
Yes.
And it indicates that if there's any, call the Suicide Prevention and Crisis Hotline. If you feel that you're in crisis, you may text home to a particular number anytime. What's a suicide hotline?
It's a phone number that patients in crisis can call and speak to a trained counselor.
Now, a psychiatrist, you'd agree with me, is not a counselor, that's for sure, right?
Well, a psychiatrist has training in therapy as well as in medicine.
Did you give Lindsay Clancy any therapy?
There was some therapy incorporated in our sessions,
Like
but
what?
we did
Like what?
providing emotional support, listening to
Excuse
her.
me. Hold on, no, please.
Hold on, everybody. She can. You ask the question, I'm gonna let her finish, and then you can follow up with any questions you want.
Take your time. Anything else you want to say?
So her sessions were largely focused on the medication management, but there was an aspect of therapy including those items.
Okay, and the sessions were for what, 17 minutes?
No,
How long were they?
25 to 30 minutes.
So 25 to 30 minutes on the television, and would you face the TV screen with her for the full 25 minutes?
Yes.
And that's not noted in your records. It says 17 minutes on all your records, doesn't it?
So if you look closely, it says the therapy component was for 17 minutes. It doesn't say the entire duration is 17 minutes.
So what do you do when you're trying to give therapy as a psychiatrist to a patient that came to see you? What do you do? What do you do with therapy?
It depends on the person.
Well, how about Lindsay Clancy? What did you do for therapy with her?
I listened to her, I listened to her concerns, and provided support. I tried to provide her with hope that eventually things would improve.
So you listened to her, you listened to her concerns, and you'd agree with me that her concerns were, for example, that she actually was unable to sleep. It's one of her concerns, right?
She was having a lot of difficulty with sleep.
On the September 15th meeting, you indicate that her mood was okay, but her affect was anxious, and you called it incongruent. What does that mean?
So she said she was feeling okay. She appeared anxious, and she also stated that she was anxious.
So one of the things that you talked about Friday is when a patient presents with an incongruent, something like that, I don't remember, appearance perhaps, that would mean that they're saying, I'm okay, but they don't look like they're okay, right?
Well, it could. I don't think her affect and her mood were really that incongruent at that time. I think that she didn't appear terribly depressed. I didn't say she was terribly depressed in that initial visit, but she said she was anxious and she appeared anxious. That's pretty congruent.
Okay. So did you put in the report that she was congruent or incongruent?
So that is not an option for me to indicate in that section, but
So-
it was congruent.
You're like a robot, you can't take a pen and write something down, you have to do the drop box and the X's on the computer?
Well, if it's on the computer, I'm limited by the options that are up
Why?
there
You're a doctor, why are you limited?
because of the technology.
What technology? The fact that there's a form on a computer? You're trying to treat a human being who comes to you for help.
And that's what's most important. What's most important was the treatment, not what is checked off on a box.
Makes sense? So, you were unable to make a note as to whether or not her affect and her mode appeared to be in conflict and that she would have been incongruent, and that she had poor insight. You couldn't write that down. Is that right? Because the box doesn't let you.
Correct.
So basically, she's telling you that, okay, well, actually, when she came, do you know that you never saw her, other than when she was in nursing school, would it surprise you, a psychiatrist? And that was only for like a week, when she got the Prozac in nursing school, because she was afraid of public speaking? Did you know that?
I was aware that she did not have a significant past psychiatric history. I was aware of that.
Okay, so you were the first psychiatrist that she had the letter, meeting, is that correct?
I think it was.
And isn't that important for you as a doctor to take a history?
I did take a history.
So can you tell us, you're testifying here for the government, tell us whether or not she had any past psychiatric history other than in nursing school when we wrote that.
She did not report any other past psychiatric history other than the Prozac and Wellbutrin.
So when a patient comes to see you and you're treating to help that patient, if they don't report something to you, you don't know about it apparently, right?
Well, I think it depends. There are certainly things I can assess, but if it's related to their history, I do need them to tell me.
Well, you can't assess it unless you ask, right?
Unless I ask or they volunteer it or
And
they
of
fill
course,
it
we
out in
already talked
forms.
about the volunteering. How about you as a doctor, when you're evaluating a patient coming to you for help, do you ask them questions?
Yes,
You didn't ask her a prior history.
I did.
What did she tell you?
She said that her prior history was what we discussed about the Prozac in the nursing school.
So, basically, other than hoping to give her hope, is what you said, for the therapy. And how do you give someone hope for therapy, the other doctor?
Try to encourage them and.
What did you encourage her on September 15th?
Sorry?
What did you encourage her to give her hope on September 15th?
What did I encourage her?
Yeah.
I don't remember exactly the words. It was
Did you write
almost
it
4
down in
years
your
ago.
records?
No, we don't write those details of
Well, that's
everything
the
that's
therapy
said.
you're talking about, right? Yes?
Yes.
And you don't write down the therapy you give the patient in the records, right?
Well, I write something about it.
You write it
I
down.
mentioned
No,
that.
excuse me.
Hold on.
So yes or no?
Hold on. You let her finish the question. If you listen to the question and answer just what they asked, okay? Go ahead. You can rephrase that question, Councilman.
No, let her answer.
All right.
I mentioned that I provided supportive therapy.
What is supportive therapy?
It's listening to the patient's concerns and providing emotional support and validation.
So emotional support and validation all sounds good. Here's a young woman who was what, 29, 30 years old, came to see you?
Yes.
And came to see you for help, right?
Yes.
Told you she couldn't sleep and she was anxious, correct?
Yes.
You know that she was postpartum, correct?
Yes.
You know that as a patient who was postpartum. By the way, what is your opinion of the period of postpartum wherein one can have postpartum depression and more importantly, postpartum psychosis? What's the time frame?
It's typically 1 year.
So she was well within that time frame, correct?
Yes.
And you tried to provide therapy by giving her hope. And how long do you figure did that take? 5 minutes, 10 minutes, 2 minutes?
I'm not sure. I think it was different in each session.
Okay. So the only thing that you diagnosed Lindsay with on September 15th was GAD, generalized anxiety disorder, correct?
It was generalized anxiety disorder as well as an adjustment disorder with depressed mood.
And you prescribed medications to her, right?
Yes.
And the medication that you provided to her was the sertraline, right?
Yes.
And the sertraline would be Zoloft, right?
Yes.
Now this is a little chart that shows the prescriptions that Lindsay was on. And you are the yellow colors. Okay? You can see that. So agree with me that on September 15th you prescribed sertraline, Zoloft, 30 count on September 15th, 25 milligrams, right?
Yes.
website for sertraline?
The website for sertraline?
Yeah. I mean, sertraline, Zoloft is a chemical that is marketed as a pharmaceutical, right?
Yes.
Right? It's a pill, right?
Yes.
And as we said, it's an SSRI pill, correct?
Yes.
Do you know that Zoloft is not indicated for generalized anxiety? Why'd you give it Zoloft?
It is a very effective medication for generalized anxiety disorder.
So you're familiar with the drug labeling for Zoloft, is that correct?
Generally.
Generally. Are you aware of what the manufacturer of Zoloft indicates it can be used for, to treat?
I'm aware that it's used to treat various forms of anxiety disorders as well as major depression.
So when Lindsay came to see you, you know that she had stopped breastfeeding her son, right?
Not at the time of the first appointment.
When did she stop breastfeeding, in October?
Something around then.
You know that she had little or no psychiatric history other than seeing you, correct?
And the Prozac, yes.
You know that, in fact, that she had stopped drinking, whatever it was that she was drinking, because you never asked, right?
I was not concerned about her level of drinking.
Well, it's in your form, right?
That was at the intake, but
Did you know that she wasn't drinking when you were meeting with her, correct?
yeah, that's what she told me.
Okay, and you believe what she told you, right?
Yes.
So when she sees you, she's not on any psychiatric, anti-tropics, or whatever they're called, medications, correct? She wasn't on any medication.
Correct.
And she had stopped drinking anything, whatever it may have been, right?
I'm not sure when she completely stopped drinking, but yes.
You don't know when she started, when she stopped, what she drank, do you?
Well, I was not concerned that she was an alcoholic.
Answer yes or no. Did you have any idea? Because we spent a lot of time on Friday talking about her guilt and having that she drank alcohol. You don't know what she drank, when she started, when she stopped, do you?
I know some details about her alcohol use, but it was overall minimal. So
What were the details then? Tell me what the details were. There was that one little box that was checked off. What are the details with it?
that she drank 1 to 2 times a week, 1 to 2 servings 5 times a week.
And you don't know what it was? You have no idea, right?
I think she had mentioned at some point that it was calming. It was something that was
what? I'm
helpful.
sorry.
Calming.
Numbing. Okay,
Calming.
so it was numbing. It was like trying to numb something, I guess, right?
That's one way of saying it.
I mean, I imagine you've treated veterans that have post-traumatic stress disorder, right?
Yes.
And would you agree with me that many times when people have an anxiety disorder or PTSD, or whatever the case may be, they try to numb their feelings? Is that fair?
Sometimes they do.
And sometimes they use alcohol, right?
Sometimes they do.
But we don't know what alcohol she was. We know if it was a beer.
I didn't think that was relevant for her.
So, with all of that, with that information, you then prescribed Zoloft to her, correct?
Yes.
You went over the side effects of Zoloft, sertraline, I imagine, with her, right?
Yes.
Did you tell her that one of the known side effects is suicidal thoughts and actions and ideation?
Well, that's specifically in children, so I don't think I mentioned that because it wasn't relevant.
Not really. Suicidal ideation and homicidal ideation is a black box warning. Zoloft, along with other SSRIs, right?
Under
Yes
age,
or no?
for children and adults younger than Lindsay.
I apologize. Can you just listen to my question and answer it yes or no? Is there a black box warning on Zoloft?
Yes.
Okay. And a black box warning is required or prescribed by what, the FDA?
Probably.
Probably. And it basically warns that, especially with young people or young adults, that it may cause suicidal or, God forbid, homicidal ideation. Yes?
Yes.
And you're aware that, in fact, the FDA has determined that that goes up possibly to a 23, 24, 25-year-old. You know that, right?
I think 24 is
24.
what they say.
Yeah, I think it's 24. It's possible, is it not, that the SSRIs that get into a person's brain affect a person that's 3 or 4 years older than the FDA cutoff with suicidal ideation or homicidal ideation? It's possible?
There's a lot of development that happens in the brain between ages like up to 24 and closer to 30. The brain is fully matured at past age 24, and so it's less vulnerable than in a younger individual.
So with 24, you're suggesting as a cutoff, are you suggesting to the jury that a drug that increases the risk of suicide in a 24-year-old patient cannot increase the risk of suicide in a 29 or 30-year-old patient? Just a little bit?
I don't believe there's evidence that it causes that at all in individuals over 24.
So, as a psychiatrist who had the ability to issue these types of medications to patients and citizens, what research did you do on Zoloft and suicidal ideation, homicidal ideation?
I was taught extensively about SSRIs and suicidal ideation in my training.
Right?
In Vermont, in Boston, yes.
Okay, so in Vermont was when you get your medical degree, right?
Yes,
And in Boston would be when you were a resident, right?
yes,
And then you had board certification on general psychiatry, right?
yes.
You can have a certification on the subspecialty, right?
There are certain subspecialties, yes.
Right, and some of the subspecialties deal with postpartum or women that are pregnant and have babies and have psychiatric symptomology.
There's no board certification for perinatal or reproductive psychiatry.
Well, there are plenty of classes that are recognized as, for example, at Harvard Medical School, there's an annual class or symposium, if you will, for postpartum. Have you ever been to that?
No, sir.
What have you done to research or to improve your education? I understand you went to med school and that you were a resident. What programs, continuing education, symposiums have you attended since you got the ability to prescribe these medicines to people?
I have not attended a symposium.
Have you attended anything?
I have not, but I have done a lot of reading on my own, of research and guidelines about this area in psychiatry.
Did you tell Lindsay when you were going, because one of the things that you guys are always concerned about is what's called informed consent, right?
Yes,
And what is informed consent? What does that mean?
it
In
means
a medical sense, not just like out in the street or something.
explaining to a patient the risks and benefits of treatment and possible alternatives, and making sure that the patient understands what you're saying.
Now, when you were going over the symptomology or when you were going over the side effects of Zoloft, one of the side effects of Zoloft is, and I quote, severe trouble sleeping, right?
Yes.
Did you tell her that?
Well, insomnia is listed as a side effect.
No. You already said yes, you know it. Did you tell her that Zoloft has a side effect of giving the patient severe trouble sleeping? That's all.
So I didn't use the word severe because it typically doesn't cause severe trouble sleeping, but I thought you were referring to when she told me that she did have severe trouble sleeping, and that
That's
was
what
true.
she told you, right? That she had severe trouble sleeping, right?
She told me, yes.
And you know that one of the side effects of Zoloft is, let's say, trouble sleeping. You know that, right?
Yes.
Your answer is yes. The jury has to be able to hear you.
Yes.
And why would you prescribe Zoloft to a young woman who's postpartum, who's coming to you with anxiety, who's telling you she can't sleep, she's got all of these symptoms, and you prescribe a medication that would have a side effect of trouble sleeping?
So individuals have very varied responses to medications. Some have no side effects, some have one or two. It's impossible to predict, but Zoloft is a top choice, a first-line medication for her. It was
Says who?
says it's the general consensus
Well, no,
among
but
psychiatrists.
lawsuits
Well,
Right.
again, you can't have both of you talking at the same time. So let her finish her answer, and then I'll give you plenty of time to follow up any questions regarding her answer. So, you finish your answer on that?
There's extensive research supporting the use of sertraline in this instance, and the general consensus among psychiatrists is that it's a first-line safe medication for individuals, including postpartum women.
How about the kids that shoot other kids in high schools and the lawsuits that come out of that against Zoloft? You ever read about them?
Overrule.
Sorry?
You didn't hear me?
I wasn't sure what the question was.
The question was, in response to your observation about how all the psychiatrists or the psychiatrists think it's a very, very safe and wonderful first-line drug, and you researched it. How about the kids that kill other kids in schools with the lawsuits that arise out of the use of SSRIs? Have you ever researched that?
I don't know much about that.
You know about the SSRIs and messing with someone's brain, they go out, they shoot people for no reason, right?
I'm not aware that that's linked to SSRIs.
So, you didn't really talk to her about increased risk of suicide. The 24-year-olds are down because she's 4 or 5 years older than that. You didn't talk to her about the trouble sleeping that can be a side effect. But you described there's other drugs that you could have given her that would be perfectly safe and calming and allow someone with no psychiatric history to sleep better, right?
Not necessarily.
Okay, so you prescribed her with the Zoloft. It was 25 milligrams, right?
Yes.
And when you prescribed her with the Zoloft, 25 milligrams, was that increased up to 0.05 milligrams, or did you increase it at some point?
The instructions were to increase it to 50 after 1 week.
After 1 week?
Yes.
And you expected that she would listen to your instructions, right?
Yes.
And she did, right?
She waited about a month, but then yes, she did.
Why did she wait a month?
I think it took her some time to decide whether that was truly what she wanted to do.
Right, she was afraid of the drugs, wasn't she?
She was afraid of side effects.
And she didn't want to take the pills, did she?
She eventually did want to take the pills because she wanted to feel better.
A month later, right?
Yes.
So you prescribe the Zoloft, SSRI, and then you tell her after a week to increase it, and she doesn't take that medication for a month, correct?
Correct.
And then she did take the medication, right?
Yes.
And did you meet with her or talk to her before she actually started to implement that particular regimen?
I had met with her beforehand, but I was not aware of when she made the decision to go ahead and take it.
So you met her on the 15th of September, right?
Yes.